Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. In this segment, we're going to be speaking with returning guest Dr. Terence Rooney. He's joining us here as Vice President, Rheumatology and Maternal-Fetal Immunology Disease Area Leader for the Immunology Therapeutic Area at Janssen Research and Development, LLC. He's returning to talk about some new data that shows TREMFYA provides durable efficacy through 2 years across the joint and axial symptoms of active psoriatic arthritis. Welcome back, Dr. Rooney. How have you been?
Great, Neil. Great to be here. Thank you.
Well, thanks for returning. For those who aren't familiar with you as a contributor, give us a little bit of your professional background and what it means to be VP at Janssen.
Oh, sure, Neil. Hi. Well, again, thank you so much for having me on. My background is I trained as a rheumatologist and an internal medicine doc, and I head up research and development for rheumatology at Janssen. I'm based here in the U.S. And as you and your listeners will probably know, Janssen has had a really strong presence in rheumatology therapeutics going back to the very beginning of the targeted therapy era. Very first TNF inhibitor, the very first and only interleukin-12-23 inhibitor, and the first interleukin-23 inhibitor, which I think we're going to talk a little bit about today because we were delighted to share some emerging data at the recent EULAR Congress.
Now, that was held in Copenhagen, correct?
Yes, exactly. Earlier this month, with the annual meeting, one of the two really big rheumatology meetings on the calendar, the other being American College of Rheumatology later in the year.
Well, give us a brief look into TREMFYA. What is this compound and how is it indicated for psoriatic arthritis?
Sure. So TREMFYA is a trade name, generic name is guselkumab. So it's a monoclonal antibody against interleukin-23. And it was the first in that particular class of therapeutics. It was first approved a number of years back for the treatment of patients with moderate severe plaque psoriasis. As you and your viewers may know, about up to 1/3 of those people develop a form of inflammatory joint disease, psoriatic arthritis. And more recently, over the last couple of years, TREMFYA was also approved for the treatment of patients with moderate to severely active psoriatic arthritis. And so those approvals stemmed from a large clinical trial program in patients with psoriatic arthritis, or PSA. And, it's really important to us, in particular after a medicine is approved, that we continue to provide information for patients, for prescribers, and other people who care for patients about the benefits and risks of our medicine. So we were delighted to be able to share a series of data about TREMFYA in PSA at the recent EULAR Congress, and I'd love to summarize some of that for you.
Great. Well, before we get into that summary, what is the current landscape as far as treatment is concerned for PSA patients?
PSA has come a long way, but there's more to do. So over the last 20 years, thankfully, a variety of targeted therapies have become available to help people really get to where they need to be with PSA, and that's to a state of remission. So remission is our mission, and that's bringing people really to a state where their signs and symptoms are so well under control that perhaps the only reason you know you have your disease is that you're taking a treatment for it. Now, up to 20 years ago, targeted therapies that could produce that kind of efficacy weren't available. But now a number of different classes of treatments are available. That said, there remains room for improvement. Not everybody gets to where they need to be. It's really, psoriatic arthritis is a complex disease where people struggle with symptoms in their joints, in their back, in their skin, of course, where psoriasis begins, and also in their general quality of life, things like pain, fatigue, and work productivity. These are big impacts for patients. So our medicines need to work across all of these different facets of disease, and ideally they should work quickly, and they need to work in a durable way because these diseases are chronic disorders that last for a long time, and so the treatments are administered for a long period of time. They need to work fast, and work in a durable way. And those are some of the features around which we shared data at that Congress recently.
Well, tell us about the data that was presented at EULAR 2022, if you would.
Sure. So we showcased, I suppose, first of all, as I just flagged, psoriatic arthritis is a complex disease where people struggle with all those different facets of the disease in the joints, their back, in the skin, and in the impact on their quality of life. Secondly, we showed durable efficacy of TREMFYA across joint, and spine symptoms of their active disease. And thirdly, we showcased data from our clinical trial program showing the impact of TREMFYA on health-related quality of life. So let me double-click on a few of those. Patients, the kind of joint and spine symptoms include features related to inflammation in the joints themselves and inflammation in the soft tissues that connect muscles and ligaments to bone. And those are things called the enthyses. So people get inflammation of those things, and that's called enthesitis. And that can produce pain that's not dissimilar to the pain associated with inflammation in the joints. People also get pain and inflammation in whole digits, like their fingers or toes, and that's called dactylitis. And finally, with respect to joints, people can get inflammation in their spine. And the inflammation that attacks each of these areas produces pain, swelling, and stiffness in those areas. So we were able to show sustained efficacy of TREMFYA from our clinical trial program in each of those areas. So the symptoms and signs related to joint inflammation, enthesitis, dactylitis, and inflammation of the spine, as well as the skin lesions. Secondly, in terms of health-related quality of life then, we were able to show impact of TREMFYA in the long term, as well as short-term data that we had previously disclosed, around important dimensions to patients. And that includes things like fatigue, general pain, including the specific pains that I just mentioned in the areas that we discussed a moment ago, and the associated work productivity hit that people often take from active psoriatic arthritis. So across these areas, from our clinical trial programs with names like Discover in psoriatic arthritis patients, Cosmos in psoriatic arthritis patients, and Voyage in patients with psoriasis, people showed improvements across those dimensions that were sustained through as long as 2 years. Now, we're pleased to be in a position to have data through 2 years for TREMFYA in psoriatic arthritis. And in psoriasis, the originator disease, we now have safety and efficacy data through 5 years of treatment. And on that really important point, of course, when people are making decisions about their various treatments available to them, they look at benefit as well as risk. Risk is a really important part of the profile of all of our medicines. So we're pleased to be able to showcase long-term safety data of TREMFYA, again, through 2 years in PsA and 5 years in psoriasis. And in general, we were able to show a consistent safety profile over time, which is really important to patients and their docs.
So obviously, this is going to drastically change the treatment landscape as a long-term alternative for patients, obviously affecting the patients and the practitioners alike.
You know, it's really important it's a delight that patients and their docs now have good treatment options for psoriatic arthritis. One of the most important and useful classes of treatment are interleukin-23 inhibitors. And, you know, we're delighted that TREMFYA was the first of those medicines to be approved for the treatment of PsA. We're now delighted to be able to analyze and share data about the long-term profile, benefits and the risks of TREMFYA for these patients. And EULAR was a great opportunity to do that. So we're always pleased to fulfill this important part of our mission, sharing important information about the benefits and risks of our medicines with patients and the prescribers and other healthcare practitioners who look after them. And EULAR was a great opportunity to do that. Yeah.
Terence, give us a website where we can learn more about Janssen and about the studies that we've been discussing briefly this morning.
Yes, certainly. So www.janssen.com will provide information generally about Janssen, including the products that are available for the treatment of various diseases, as well as the research development activities that we have in place for our approved medicines and our pipeline of emerging therapies. Well,
I look forward to you coming back and telling us how things develop. Thank you for returning, and I'm looking forward to our next conversation, Terence.
Oh, thank you so much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest, Dr. Terence Rooney. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.